Thank you, Mr. Vice President. To start, I want to really thank all the ministers of health around the world who have been sending us their data despite the fight that they're in themselves, particularly our European colleagues. They continue to send us primarily their mortality data, which is really very critical because when you're in the midst of this level of fight that many of the European countries are, following mortality data will give you the best insight right now on how the epidemic is proceeding in those countries because they really can't be testing at the level to really understand the depth and breadth of their new cases. In the mortality data that has been provided to us, there has been no child under 15 that has succumbed to the virus in Europe. There was the one 14-year-old in China. So we still see that there is less severity in children. And so that should be reassuring to the moms and dads out there. To Generation Z and to my millennial colleagues who have been really at the forefront of many of these responses, less than 1% of all the mortality is less than 50. And so this is, I think, also a very important point. That doesn't mean that individuals won't have severe disease. So still 99% of all the mortality coming out of Europe in general is over 50 and pre-existing conditions. The pre-existing condition piece still holds in Italy, with the majority of the mortality having 3 or more pre-existing conditions. I think this is reassuring to all of us, but it doesn't change the need to continue to protect the elderly. And in order to protect the elderly, we all need to continue to do the President's directives and guidance for the next week of the 15-day challenge. Finally, I wanted to really close by thanking the laboratory personnel that have been at the front lines. 250,000 tests have been run in the last 7 days. This happened because these large commercial laboratories are doing round-the-clock runs. And remember, all of them are being exposed to the virus in the same way from the swabs. Yet tirelessly, they have worked on and on to get those results available. They are still getting more tests than they can run per day. That's because we were primarily expanded into what we call the Roche high-throughput tri-core machine. Those results have been getting to the clients, and we've asked them to prioritize hospitalized patients. There was a breakthrough today, and I think you'll see this from the FDA, for all of those of you who are waiting for self-swabbing options. Those are going to be available sometime this week to be able to individuals do their own tests. That said, remember, these platforms are keeping up with those who need to be diagnosed in the hospitals and those who come to the emergency room quite ill so that hospital beds can be freed up for those that don't have COVID. So that will be critical that if you don't need a test and if it doesn't change your clinical course, do not come in to be tested. And I think that mortality data that I gave you should be very reassuring to all of you. Finally, to conclude, New York City. The New York metro area of New Jersey, New York City, and parts of Long Island have an attack rate close to 1 in 1,000. This is 5 times what the other areas are seeing. Through the high-throughput lab investigations, we're finding that 28% of the submitted specimens are positive from that area, where it's less than 8% in the rest of the country. So to all of my friends and colleagues in New York, this is the group that needs to absolutely social distance and self-isolate at this time. Clearly, the virus had been circulating there for a number of weeks to have this level of penetrance into the general community.
Thank you very much, Deborah.